Which of the following vaccine is given to a pregnant lady? A. Measles, B. BCG, C. Tetanus, D. DPT. And the correct answer is C. Tetanus. Tetanus toxoid is a vaccine which is given to a pregnant woman. First dose of tetanus toxoid is given at 16 to 24 weeks of pregnancy or as soon as pregnancy recognized. And second dose is given at 24 to 30 weeks of pregnancy. Second dose of TT should be given 1 month before expected date of delivery. Maximum interval between two doses of this vaccine should be 1 month. Tetanus toxoid is 0.5 ml dose which is given intramuscular on arm. DPT vaccination provides protection against A. Diarrhea, pertussis, tetanus, B. Diarrhea, polio, tetanus, C. Diphtheria, pertussis, tetanus, C. Diphtheria, polio, tetanus. And the correct answer is C. Diphtheria, pertussis, tetanus. The DPT vaccine is a combination of vaccines against three infectious diseases in humans, that is diphtheria, pertussis and tetanus. Pertussis is characterized by whooping cough. Recommended administration site of DPT vaccine in infants is A. Gluteal, B. Deltoid, C. Lateral aspect of thigh, D. Forearm. And the correct answer is C. Lateral aspect of thigh. All intramuscular vaccines including DPT, now it is pentavalent in place of DPT in infants, should be administered in vastus lateralis muscles of lateral aspect of thigh. The color of center square in the vaccine vial monitor in a well stored polio vaccine should be A. White, B. Violet, C. Blue, D. Pink. And the correct answer is A. White. VVM, that is vaccine vial monitor, is a small label stuck on the vial of polio vaccine which changes color as the vaccine vial is exposed to heat. The color of the VVM center square indicates whether the vaccine is safe for use or not. It is a small light purple circle with a white square in the center. The square remains white if there is no exposure to heat. With heat exposure, the square begins to changes in darken color. What would you do if the VVM of oral polio vaccine indicates unusable? A. Give vaccine to the child. B. Report to the CMHO. C. Do not give the vaccine to the child. D. Vaccine while kept in the sunlight. And the correct answer is C. Do not give the vaccine to the child. As soon as the square of vaccine vial monitor becomes darker, the heat may have damaged the vaccine and the vial should be discarded. Pulse polio immunization is A. Program, B. Campaign, C. Institution, D. Organization. And the correct answer is B. Campaign. Pulse polio immunization, that is also known as PPI, is the largest public health campaign of country for the eradication of polio. First round of PPI is conducted on 9th of December 1995 and 20th of January 1996 for the 6 weeks of interval. Most heat resistant and heat sensitive vaccine is A. TT and DPT, B. TT and OPV, C. DPT and measles, D. DT and OPV. And the correct answer is B. TT and OPV. TT is the most heat resistant vaccine which can be stored at room temperature, and OPV is most heat sensitive vaccine which should be stored at minus 20 degrees centigrade in deep freezer compartment. Which vaccine should not be administered to child with history of anaphylactic reaction to neomycin? A. OPV, B. IPV, C. BCG, D. Measles. And the correct answer is B. IPV. Few vaccines like MMR and IPV, that is inactivated polio vaccine, contains antibiotic neomycin to prevent bacterial contamination. So it should not be administered to child with history of anaphylactic reaction to neomycin. What age group of children is given oral polio vaccine under pulse polio immunization program? A. Up to 1 year. B. Up to 3 years. C. Up to 5 years. D. Up to 7 years. And the correct answer is C. Up to 5 years. When was first round of pulse polio immunization started? A. December 1994. B. December 1995. C. January 1994. D. November 1996. And the correct answer is B. December 1995. The oral vaccine used to prevent A. Mumps, B. Tuberculosis, C. Polio, D. Measles. And the correct answer is C. Polio. Inactivated polio vaccine IPV is administered as A. Subcutaneous injection, B. Intramuscular injection, C. Intravenous injection, D. Oral drops. And the correct answer is B. Intramuscular injection.